Hey there. Hi, it's Nancy, the nurse practitioner. I'm just, first of all, checking to see how we're all doing out there and just sending you my good wishes and prayers that we will all continue to get through this together. But I'm going to talk to you today about how to use a nebulizer. A nebulizer is a machine that looks like this. It is used specifically to help people open their lungs and remove secretions and mucus, specifically for people with cystic fibrosis, asthma, chronic obstructive pulmonary disease, which is chronic bronchitis or emphysema, people that have cystic fibrosis, and a lot of patients who have pneumonia use it. I also use it for my patients who are elderly and bedridden as a respiratory toilet, so to speak, mechanism, and twice a day they would just use a low dose albuterol in this machine to help them just cough and deep breathe and bring up any mucus since they're not moving much. So you saw what a nebulizer looks like. It does come with a doctor's order to get it from your pharmacy. They run between $45 and up to $100. Most insurances pay for it if a right code is used for the diagnosis. The first thing you're going to do when you use a nebulizer, if it's ordered, is to wash your hands. And as we've gone over on other videos, it's washing your hands for 20 seconds and, front and back and all that, drying them well, and then you can take care of this nebulizer. So the machine needs to be plugged in. You need to check to see if the filters are dirty. Some of them have filters, some don't. Like you would just unscrew this and see if there is one that is needed here. This particular machine does not have one, so make sure you look at your factory paperwork. Don't ever throw any of that away, the guidelines, because it will help you know if you need to have filters. And it's always good to have extra tubing and an extra filter on hand. It depends on what people are using. Some people can use a tubing with a mouthpiece, and it comes like this. You get a tubing. It actually connects to the machine, and I will show you that in a minute. The other end connects, this little area connects to a box like this. And in this little connector is actually the cup. The cup actually just takes apart like this. And when your hands are clean and it's clean inside, which, by the way, every time you use it, which is like a 10-minute treatment, you are then going to wash it out with, you can either do 1 part distilled vinegar and 3 parts water. Just soak it in there for a few minutes, rinse it off with warm water, and put on a paper towel to air dry. Or you could actually put the whole machine back together again and put it on, and the air will dry it. But I usually tell people leave it on a paper towel till the next use. So it's going to look like this. And then basically your medications come in packages. They look like this. Make sure that the medications are not expired. This one is good like till May 2021, it says on the back. The package opens. Some of them are mixed packages, like this one is actually something called albuterol with ipratropium, used usually for emphysema, and it has 2 medicines in one. And it's a 3 little cc ampule, which you rip off like this. Okay? And you would twist off the top. This is a nice little sterile container, which now has medication in it. You'd pour it into the cup, just like this. You can see that okay. Until it's all in there. And then you're going to take the top and you're going to screw it back on like this. You've already screwed on the bottom, and on the machine at the other end is a screw on. You can see that. Then you continue to put the mouthpiece on like this. And then there is actually an area where this goes on like that. And this is where the person puts it in their mouth and blows. When you turn on the machine, I'll turn on my machine here, see where the on and off button is. It makes a noise. It smokes like that. The person's supposed to put it in their mouth and just breathe in and out. And keep it on their mouth. And if they start talking or they stop doing it, turn it off until they're ready to do it, because you don't want to lose this medicine. you know, as they're breathing it in, you could see the smoke disappearing in and then it breathes out. And when it's totally empty, it actually makes this kind of like light, high sound. And you could see the cup is actually empty. There's no medicine in it. Then you would turn the machine off. Okay? Once the person is done with the machine, of course, give them a couple tissues because they start to cough and move secretions around. So they want to be able to remove that. Okay, so the next thing you're going to do is to make sure that, like we said, take it apart. You can wash it off and you can then put on a paper towel and let it be used for the next time. And it's a good idea to have extra tubing. Like I said, in every 6 months, this tubing should be changed. The filters should be changed regularly based on the manufacturer's instructions. And you never throw the nebulizer or any of its parts in the dishwasher, of course. If the person can't hold the mouthpiece or if they won't keep their mouth shut on it, there's also a device like a face mask. Looks like this. Okay? You can actually have that ordered. It's a face mask with the tubing. Similar idea. Comes together with a cup. I just screwed the cup on like this. This goes on the bottom like this. And the same kind of situation. Screws onto the machine. Medicine goes in here. And then this just goes over their head. And you could actually crimp it so it fits nice. So your mom, you could even fix these a little bit so it's nice and tight. And then your hands are free. Your mom could be sitting there breathing the medicine in and out, which is exactly what you do. So it's hands-free. You know that she won't be moving it, that you don't have to worry about it not being used. Have some tissues available. When it makes the same light sound, you know it's empty. And that's all you need to do. Now, nebulizers don't last forever. I had a patient who had one and it was taking her 30 minutes to do a treatment, and I knew that wasn't right. And I found out that her machine was over 5 years old, way too old. So I got her a new machine, and in 10 minutes she did the treatment. She felt much better because she got a better air exchange through the nebulizer. And of course, she felt much better and got rid of a lot of secretions a lot easier. So make sure you know who your vendor is. And make sure that you keep track of having enough tubing, filters, just going over some things in my book just to make sure we're covering everything. That's basically it. As far as the mask goes, all you have to do is, again, take this apart, take the cup off, wash it in 1 part vinegar, 1 part water, rinse it out really good with hot water, put it on a paper towel, separate it, wash this really well with warm water, and put it on a paper towel till it dries, and then reassemble it for the next use. It's also a good idea to not put your nebulizer on the floor ever, and to put it in a plastic bag or a box on a shelf for the next use so you're ready to go. Okay, so hopefully that answers any questions about how to use a nebulizer. I hope this helps you. If you have any questions, you could always email me at nancythenp@gmail.com. And take care for now till the next video. Stay well. Bye.